Today we will quickly revise oral lesions in pathology, and at the end there would be mcqs. Oral lesions are abnormal changes in the tissues of the oral cavity. Understanding their morphology is crucial, as some lesions could progress to malignancy if undiagnosed or untreated. Oral lesions are broadly classified into benign, premalignant, and malignant lesions. Benign lesions include fibroma, papilloma, and pyogenic granuloma. These lesions are localized and non-invasive. Premalignant lesions include leukoplakia and erythroplakia, both of which have the potential to progress to malignancy. The most important malignant lesion of the oral cavity is squamous cell carcinoma. Fibroma is one of the most common benign oral lesions and usually develops as a reactive lesion due to chronic irritation or trauma, such as cheek biting or irritation from dentures. Morphologically, it appears as a smooth, firm nodular mass that is usually painless and slow-growing. Histologically, fibroma consists mainly of dense fibrous connective tissue covered by stratified squamous epithelium. An important point is that fibroma is considered a reactive hyperplasia rather than a true neoplasm. Squamous papilloma is a benign epithelial tumor associated with HPV types 6 and 11. Clinically, it presents as a small pedunculated papillary lesion with a cauliflower-like appearance. Microscopically, finger-like projections of stratified squamous epithelium supported by fibrovascular connective tissue are seen. It is a benign HPV-associated lesion with very low malignant potential. Pyogenic granuloma is a reactive vascular lesion commonly occurring on the gingiva. It usually develops after trauma, chronic irritation, or hormonal changes such as pregnancy. Morphologically, it appears as a red soft mass that bleeds easily because of its rich vascularity. Histologically, numerous capillaries, granulation tissue, and inflammatory cells are present. Despite its name, pyogenic granuloma is neither pyogenic nor a true granuloma. Leukoplakia is defined as a white patch that cannot be scraped off and cannot be clinically diagnosed as another disease. It is strongly associated with smoking, alcohol use, and chronic irritation. Histologically, leukoplakia may show hyperkeratosis, epithelial dysplasia, or even carcinoma in situ in advanced cases. It is important to remember that leukoplakia is the most common premalignant lesion of the oral cavity. Erythroplakia presents as a red velvety plaque on the oral mucosa. Although less common than leukoplakia, it has a much higher malignant potential. Histologically, most cases already show severe dysplasia, carcinoma in situ, or early invasive carcinoma. Therefore, erythroplakia is considered more dangerous than leukoplakia. Oral squamous cell carcinoma is the most common malignant tumor of the oral cavity. Major risk factors include tobacco smoking, alcohol consumption, betel nut chewing, and HPV infection. Common sites include the floor of the mouth, ventral surface of the tongue, and lower lip. Early diagnosis is very important because delayed presentation worsens prognosis. Grossly, oral squamous cell carcinoma may present as an ulcer, a fungating mass, or an indurated lesion. Microscopically, invasive nests of malignant squamous cells are seen infiltrating underlying tissue. Keratin pearl formation and intercellular bridges are characteristic histological features. Clinically, patients commonly present with a non-healing ulcer, pain, dysphagia, or difficulty eating. Now let's quickly revise the important oral lesions in a summary table. Fibroma is a benign lesion that presents as a smooth nodular mass and usually develops due to chronic irritation. Histologically, it consists of dense fibrous connective tissue. Squamous papilloma is another benign lesion associated with HPV types 6 and 11. It appears as a small papillary or pedunculated lesion. Pyogenic granuloma is a reactive vascular lesion that commonly occurs on the gingiva and tends to bleed easily because of marked capillary proliferation. Among premalignant lesions, Leukoplakia is the most common. It presents as a white plaque that cannot be scraped off and may show hyperkeratosis, dysplasia, or carcinoma in situ on histology. Erythroplakia presents as a red velvety plaque and has a much higher malignant potential than leukoplakia. Histologically, severe dysplasia or carcinoma in situ is commonly seen. Finally, oral squamous cell carcinoma is the most common malignant tumor of the oral cavity. Grossly, it may appear as an ulcer, fungating mass, or indurated lesion. Microscopically, keratin pearls and intercellular bridges are characteristic findings. So these are the most important benign,